When loved ones with Dravet syndrome experience fewer seizures and more seizure-free days, the sound is profound. This is Ryker, who was prescribed FINTEPLA, phenfluramine, for seizures associated with Dravet syndrome. Step into his world and experience the profound impact of seizure-free moments, full of sound, full of life.
We love Ryker for who he is. He just brings so much joy to our family. Ryker was typically having at least one tonic-clonic seizure per day. A lot of times he had head drop, quick seizures. I remember tallying like 15 seizures in a day.
Another rock. Hold it. There you go. 1, 2, 3, go.
Because of the risk of heart problems, Ryker is enrolled in the FINTEPLA REMS. Ryker needs an echo test every 6 months while taking FINTEPLA to monitor cardiovascular safety. The monitoring can identify problems with the heart before symptoms arise. We hear more and more squeals every day, which is really exciting. To see him smile and laugh, it's something that you can't describe.
Indication: FINTEPLA is a prescription medicine used to treat seizures associated with Dravet syndrome and Lennox-Gastaut syndrome in patients 2 years of age and older. It is not known if FINTEPLA is safe and effective in children less than 2 years of age. Important safety information: FINTEPLA can cause serious side effects, including 1. Problems with the valves in the heart, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, have been associated with FINTEPLA. Your healthcare provider will do a test called an echocardiogram to check your heart and to evaluate for high blood pressure in the arteries of the lungs before you start taking FINTEPLA. Again, every 6 months during treatment and one time 3 to 6 months after you take your last dose of FINTEPLA. Call your healthcare provider right away if you develop any of these signs and symptoms of heart or lung problems during treatment with FINTEPLA. Shortness of breath, tiredness or weakness, especially with increased activity, lightheadedness or fainting, swollen ankles or feet, chest pain, sensations of a rapid, fluttering heartbeat, palpitations, irregular pulse, bluish color of your lips and skin, cyanosis. Because of the risk of heart valve problems, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, FINTEPLA is only available through a restricted program called the FINTEPLA Risk Evaluation and Mitigation Strategy, REMS. Before you or your child receives FINTEPLA, your healthcare provider or pharmacist will make sure you understand how to take FINTEPLA safely. If you have any questions about FINTEPLA, ask your healthcare provider. Visit www.finteplarems.com or call 1-877-964-3649. 2. Decreased appetite and decreased weight. Decreased appetite and decreased weight are serious and common side effects of FINTEPLA. Your weight should be checked regularly during your treatment with FINTEPLA. Your healthcare provider may need to make changes to your FINTEPLA dose if your weight decreases. In some cases, FINTEPLA may need to be stopped. 3. Sleepiness, sedation, and lack of energy, lethargy. These are serious and common side effects of FINTEPLA. Taking FINTEPLA with central nervous system, CNS depressants, including alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how FINTEPLA affects you. 4. Like all other anti-epileptic drugs, FINTEPLA may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of these symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, trouble sleeping, insomnia, attempts to commit suicide, new or worse irritability, new or worse depression, acting aggressive, being angry or violent, new or worse anxiety, acting on dangerous impulses, feeling agitated or restless, an extreme increase in activity and talking, mania, panic attacks, other unusual changes in behavior or mood. How can I watch for early symptoms of suicidal thoughts and actions? Pay attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Suicidal thoughts or actions can be caused by things other than medicines. If you have suicidal thoughts or actions, your healthcare provider may check for other causes. 5. Do not stop taking FINTEPLA without first talking to your healthcare provider. Stopping a seizure medicine such as FINTEPLA can suddenly cause you to have seizures more often or seizures that do not stop, status epilepticus. Do not take FINTEPLA if you are allergic to fenfluramine or any of the ingredients in FINTEPLA. See the medication guide for a complete list of ingredients in FINTEPLA. Are taking or have stopped taking medicines called monoamine oxidase inhibitors, MAOIs, in the last 14 days. This may cause a serious or life-threatening problem called serotonin syndrome. If you are not sure whether or not you are taking one of these medicines, contact your healthcare provider. Before taking FINTEPLA, tell your healthcare provider about all your medical conditions, including heart problems, weight loss, depression, mood problems, or suicidal thoughts or behavior, kidney problems, liver problems, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of FINTEPLA? FINTEPLA may cause serious side effects, including see FINTEPLA can cause serious side effects above. Serotonin syndrome. Serotonin syndrome is a life-threatening problem that can happen in people taking FINTEPLA, especially if FINTEPLA is taken with certain other medicines, including antidepressant medicines called SSRIs, SNRIs, TCAs, and MAOIs, tryptophan, lithium, antipsychotics, St. John's wort, dextromethorphan, tramadol. Call your healthcare provider right away if you have any of the following symptoms of serotonin syndrome. Mental status changes such as seeing things that are not there, hallucinations, agitation or coma, changes in blood pressure, tight muscles, fast heartbeat, nausea, vomiting or diarrhea, high body temperature, trouble walking. High blood pressure, hypertension. Hypertension is a serious and common side effect. FINTEPLA can cause your blood pressure to increase even if you have never had high blood pressure before. Increased pressure in your eyes, glaucoma. Symptoms of glaucoma may include red eyes, seeing halos or bright colors around lights, nausea or vomiting, decreased vision, eye pain or discomfort, blurred vision. If you have any of these symptoms, call your healthcare provider right away. The most common side effects of FINTEPLA when used to treat patients with Dravet syndrome, DS, include decreased appetite, diarrhea, low energy, respiratory infection, decreased weight, fever, constipation, abnormal echocardiogram, sleepiness, problems with movement, balance, and walking, increased drooling, increased blood pressure, vomiting, falls, seizures that do not stop, weakness. The most common side effects of FINTEPLA when used to treat patients with Lennox-Gastaut syndrome, LGS, include diarrhea, tiredness, vomiting, sleepiness, decreased appetite. These are not all the possible side effects of FINTEPLA. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Keep FINTEPLA and all medicines out of the reach of children. Please see full prescribing information, including medication guide, for additional important safety information on FINTEPLA.